for medication refills. Please hold for the next available representative.
Specialty Clinic, how may I help you?
Hi, my name is Lauren Love. I'm sorry, I have a lung disease, and so it will take me a second to talk. I saw a doctor at your clinic named Dr. Zulik, and when she did everything, it was basically malpractice. And now I'm dying, but she did not tell the nursing home anything. So the nursing home has been treating me like nothing is wrong. She did not tell them about, I don't know if the test results were not sent immediately when I have proof that my lungs have been collapsed for 5 years, but Dr. Zulik did not take any of the time to listen to me. I have talked to many of the nurses there, but nobody will actually do anything to help me, even though I've been there many times and they wasted my time. So I can't even get help if I want to. I'm just dying. My other
What,
organs are messed up too. I need to talk to a nurse, but I also think that I need you to tell somebody that's in charge of the office to call me back before my voice is gone, because I am going to be posting videos about everything that was done to me. And you guys might want to change how I feel about you before I post my final videos before I die, because this is letting me die and it's malpractice, and you will be part of the wrongful death suit. Now we are already starting because it's obvious that I'm just going to die without hospice. Dr. Zulik is part of this, and nobody called me back. Patient experience did nothing. So sorry to tell you so much, but I don't know who to.
what's your date of birth?
6982.
6982. And your name?
Lauren Love. But please don't send me to patient experience, because all they do is ignore me and then send me a letter saying they're gonna take a note of it. And I tried to write them and say, I can't talk. Can you please send this note up to you guys? And they couldn't even do that.
Give me one sec. Let me put you on a brief hold, okay? Give me one sec.
Thank you.
FALSIFYING is a hospital and level 2 trauma center dedicated to improving and inspiring healthy lives. As a public healthcare system, we provide compassionate, high-quality healthcare to everyone in Monterey County, regardless of their ability to pay or immigration status. Natividad offers a wide range of inpatient, outpatient, emergency, diagnostic, and specialty medical care for adults and children. Thank you for holding. Someone will be with you soon. Natividad is proud to offer expert maternity care with a full range of services for women, babies, and their families. Newsweek nationally recognized Natividad as the best maternity hospital in 2020. Find out more at natividad.com. Home to the area's only Level 2 trauma center, Natividad's specialized personnel, equipment, and services provide a vital local community service that treats the most severe and critical injuries, saving lives and keeping patients close to home. Thank you for holding. Someone will be with you soon. As the largest acute rehabilitation center on the Central Coast, Natividad offers a wide range of specialized treatment plans.
Okay, Lorraine, did you ever go to the Stanford Pulmonology and sleep over there?
Yeah, I've been trying to talk to you guys about that. I tried to do that, but then somebody called them and said something. I don't know who it was, but I've been trying to fix that for a long time because I've been getting bullied. Like I think I've told you guys before, and that's why I've asked you if anybody gets phone calls to let me know because the people in the nursing home where I am have been calling around and really like the people who like the CNAs and stuff have been bullying me and that's just is a long story, but I'm trying to get back to Stanford. The problem is that I haven't been able to coordinate it like I told you guys 100 times. That's over an hour away, and I'm oxygen dependent now, and I'm also unable to move because of the pain that I'm in. So I can't get that far. I tried to schedule it, but I had so many tests that he just gave up and said I was non-compliant, even though I was just trying to figure out how to get there, you know, and do all the
Mm,
tests. And they, it's a long story, but I've already told you guys a lot of times, and I've written emails, but they don't tell you guys anything. And then the problem is that I would call you guys. Before the Stanford thing, because I needed a respiratory therapist. I have not had one at all. And meanwhile, I have proof that my lungs have been collapsed this whole time. It just doesn't show up in every scan. I have an X-ray that it shows up in. I just the thing is that Dr. Zulik never let me show her everything, and she didn't care about any of my X-rays that showed anything. She just said, "Well, let's do another test. That's what I'll trust." It's like, okay, but you're not going to look at. She never ordered any of the tests from Stanford. She never ordered any of the tests. Sorry, you guys, I'm on the phone. Can you guys let me? Sorry. Um, she never ordered my test from Stanford, and there were 4 CT scans showing scarring as well as showing um, uh, atelectasis or partial collapsing. So both of my lungs have had that issue, and I know from a new X-ray that showed up, it just doesn't. Everything doesn't show up in everything, and they are ignoring my symptoms like they're not real. Like I can feel my lungs have no vibration anymore. The bottoms of my lungs have not worked for a long time. And there's proof in those tests, but they didn't tell the nursing home anything. And I've left many messages and I've asked them, I said, hey, you told me that I need a higher level of care. You need to tell the nursing home because the nursing home is going around acting like I don't need help at all. And I don't know why. Um,
okay.
and it's nerd,
Let me.
but you, I'm almost, hold on, I was on, but you guys didn't actually communicate anything when they said they did. And apparently, from what the nursing home's saying, they're acting like you guys said I don't need oxygen and I don't need help. But the thing is then why would you say that before I get tested for anything? I mean, and there's already like evidence showing that I'm dying. There's evidence everywhere and no one's listening. And I just because I'm not hypoxic doesn't mean anything because I'm gasping, you know? So there's proof of
I
everything. I have everything documented. It's just I have no access to you guys because nobody will let me text you or me messages through like any way, you know? Like two,
so I'm gonna go.
sorry, go ahead.
I'm gonna transfer you to Dr. Zulik's MA. Okay.
Yeah.
I'm only the call. Okay. I'm going to transfer you.
And I can't tell what you just said. You said for me, so I but but you just because the person that they always make me talk to, she doesn't seem to be very connected, like it's like she doesn't understand English very well or something, and I'm having a really hard time talking to her, and it already hurts to talk. Every time I've ever talked to her, she never resolves anything, she never actually does anything, and I waste my oxygen. So I don't know why they keep sending me in circles, but like somebody, like I need somebody who's in charge of the office or in charge of something because patient relations is doing nothing. And you guys need to make sure I have a respiratory therapist because what you did was try to send me over to Stanford, and I told them already. They tried to send me to Stanford. I told them, what, I'm too sick probably. What if I land in your ER and I don't go to
Oh,
the hospital because you guys haven't even looked at my other records and you're trying to act like I'm not sick. The thing is you didn't tell the nursing home. So now the nursing home won't give me pain control and they have made it impossible to get hospice. and I'm dying.
Okay, give me 1 second. I'll try to help you. Okay, let me get you some help.
Okay.
For English, press 1. Para instrucciones en español, oprima 2. Thank you for calling the Diarigo Family Specialty Services located at Natividad. Gracias por llamar a la Clínica Familiar de Especialidades de Arrigo, ubicada en Natividad. Para español, oprima 1. If you are experiencing a medical emergency, please hang up and dial 911. For medication refills, please contact your pharmacy. Your pharmacy will contact the office for medication refills. Please hold for the next available representative.
So where did you send? Just spent all that time using my voice, and she's gonna send me on a goose chase. Are we serious? Are you serious? I just spent 10 minutes talking. 10 minutes. And these people are going to let me die without even making sure I have anything that I need. So, what's happening? Where is everything? Am I still on hold? And where did they send me to? I don't understand. Like that, they should be telling me. I thought I was getting sent to the medical fucking person, and now they just send me in a. Like, if you just tell me who I'm talking to and retain information, or are you gonna go into legal mode and not protect me at all? Why am I wasting my time? Nobody's gonna help me. Every single person I ask for help, every single one of them fails me and they let somebody else deal with it. Well, you're all going to be held responsible. What you're doing to me is evil. I just wasted so much of my breath. I feel like I'm wasting every minute of my time. I have no idea what I'm waiting for. Am I just going to get hung up on? I have asked so many times for them to do this. I've asked for help so many times. Every time that I ask for help from people, they always just send me in circles. They don't care what happens to me. That's garbage. I don't know who this person was, but if I don't get a phone call from Natividad, make sure Natividad Hospital is in trouble because my lungs are bad. They didn't order everything. They did not fucking send anything to the nursing home. And I'm saying all this because my call is being transcribed. So if nobody answers, at least this is how everybody knows. I just wanted to let everybody know who I'm going to share this with, that this is what I deal with while I'm dying. I don't get help. The nursing home will do nothing. There is nobody in this building that takes responsibility. If I tell them anything, they just ignore me. They just let me die. And Natividad Hospital, I thought they were going to be good, but I have been denied like the help I need. I asked for what am I going to do if I end up in the emergency room? Nobody cares. Thank you, Crystal. I don't want to die this way, and they're not even willing to talk. They don't even call me. My life isn't worth anything to Salinas Valley Post Acute or Natividad. And they will all be fucking known for this because they can't run away from completely neglecting someone and then mistreating them when they beg for help. Well, I guess I'm not getting an answer. Well, I've already been sitting here for 15 minutes. I guess it's a waste of time for me to try.